The number of COVID-19 cases in American children jumped 21% just this month alone. Thank you for staying with us. I'm Alan Campbell.
And I'm Amira David in for Glenda Lewis. The news comes as school districts across the country are welcoming students back to in-person classes.
Our chief health editor, Dr. Nandi, joins us now with more on why we're seeing an increase in coronavirus infections among children. This is pretty concerning, Doc.
Absolutely, Alan. And this is super important information, especially if you're a parent like me with school-age children, and a lot of people watching are. So the American Academy of Pediatrics and the Children's Hospital Association reported more than 70,000 new COVID-19 cases in kids, Alan, over just a 2-week period of time from August 6th to the 20th. While that seems like a large increase, experts say that they're not really surprised about the uptick in cases. That's because kids in some states have already returned to school, and that's why we're seeing so many new COVID-19 infections. For example, hundreds of students and staff, and you already know this, had to quarantine in Georgia after school districts reported that cases of COVID-19. A similar situation is playing out in Mississippi, where nearly 5,000 students and teachers are quarantined. And one of the hardest hit states is Florida. So nearly 9,000 new COVID-19 cases were reported in children over a 15-day period this month. Super concerning.
Yeah, you hit us with a lot of numbers there. What's the overall rate of coronavirus infection among children? And what do we know furthermore about how this disease is affecting them?
I mean, I just talked about, some of the new cases, but overall, the new report shows that over 440,000 children have been infected with the coronavirus since the pandemic began. According to the CDC's latest data, children make up more than 7% of all coronavirus cases in the U.S. Although the infection rates amongst children are rising, the new report says it's rare for them to become severely ill from the coronavirus. That's good news. However, the CDC is seeing an increase in the number of kids hospitalized with the virus, and about 1 in 3 of those children are admitted to the ICU. So that's a concerning number to me as well.
So, Dr. Nandi, for all of us here, just remind us again of the COVID-19 symptoms in children.
Absolutely. Alan, the symptoms are similar to those in adults. Parents should be on the lookout for mild cold-like symptoms such as fever, runny nose, and coughing. Nausea and diarrhea have also been reported in children. As you know, they've also been reported in adults. Certain underlying medical conditions put children at higher risk, so check with your health professional if you're concerned about your child's health and make sure you know what those are. And again, we have to stay vigilant as the fall season arrives and school begins. Children, in my opinion, should wear a mask, wash their hands often, practice social distancing, and stay home if they're sick. All of this will help reduce the infection rates. We know that there is going to be an uptick in infections as kids return to school. Let's limit that as much as possible and learn the lessons we're learning from some of the southern states, as we talked about.
Yeah, Doc, some important information there. And as you said, we all have to be very vigilant to mitigate the spread of the virus. Thank you so much. It's great seeing you.
My pleasure. Thank you.
And remember, if you have a coronavirus question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or be sure to send it to us on Facebook or Twitter.